We wash our hands. I didn't even think about it because I do wash my hands, and I didn't know that all this time my thumbs weren't getting the attention they need. They were lonely thumbs. And so you got to really get in there because you do a lot of things with your thumbs. I mean, it seems basic, Bree. It does. And I know probably part of you is like, come on, people know how to wash their thumbs. But, I mean, if I was overlooking it, a lot of other people probably were.
True.
7:31, let's head over to the Zoom room. Standing by the hospital administrator, Lillian Posadas. Lillian, thanks for joining us.
Yes, good morning.
Good morning.
Good morning. Just so we'll play a little catch up. How are you holding up, Lillian? I mean, you've been in here since day one.
Yeah.
This thing just won't end.
Right. Since March, but God is holding me up. He's sustaining me and my husband. He's supporting me too, so it helps.
You do a lot of praying, Lillian? Are you a praying woman?
I do.
Right.
We need to.
Right.
Exactly.
It's funny. I'm pretty sure God is kind of chuckling, but now me and God right now, God is like, oh, now you know me, Chris. Oh, wow. Hey, haven't heard from you in a while, boy.
Please, you are religious. Don't let your mom call into the show.
Yeah, right. I know. So
we got a great team. We got a great team here at the hospital. We have really just a fantastic team.
Lillian, when we're especially for the frontliners, when you're kind of in the trenches, fighting this thing, and something comes out like the governor testing positive for COVID-19, things come out where we're just in this surge that you have consistently warned people about. I remember when we were reopening things, you were on this show and you were saying, I don't really feel good about this. So just unpack for us, if you will, when you heard the news about the governor and just the surges that kind of led up to that, where did it put you just mentally?
Well, again, serious concern and worry, and that, the message needs to keep being pounded into the people's minds. Wear your mask. Do social distancing. All the more we need to do it because it's getting really close to home as far as look at Dr.
Yeah.
Like you said, a physician, and so you and us nurses, sometimes we we're human beings, so we take off our masks when we're with our families and friends, and we just have to remind each other, oops, okay, got to put back the mask on.
Right.
Yeah.
So
I mean,
it's serious concern.
And we're at a point, Lillian, where we are kind of taking it for. It's weird. I went somewhere yesterday. I was on the road. I didn't even realize I went all the way to Umatic that I forgot my mask. So I stopped at the store. I went to go get down, and I was like, "Oh my God,
You can't go.
I can't go in the store."
Yeah.
And I got down at my house, and I wore my mask down at the house. And people tell me, "Why are you wearing the mask?" Because I need to make it a habit, and I'm forgetful. And if I don't wear this thing like all the time, I mean,
Yes.
So I got down to the store and I had to go look for a T-shirt.
I have my mask on because, like you say, you got to make it a habit.
Right. Yeah.
I have like a COVID kit in my car.
Right.
Like I have disinfectant spray, extra masks, gloves,
Right.
wipes. It's just all in a little in a little box that I just keep in my car just in case I forget.
Yeah, she's got it. It's stored right next to the zombie
Right here,
apocalypse
even
bag.
here. Here's my
Keep it in
other
your
kit.
backpack.
Right.
Yeah.
Yeah.
Right.
Lillian, now that we kind of caught up, let's just get right into it. Something that really alarming and scary, the increase in hospitalizations. Just if you could just go in and tell us about these 7 hospitalizations at the Guam Memorial Hospital.
Okay, we've got like 4 males and 3 females. The gentleman who's in his 30s is still in the ICU on ventilator support. The other individuals have some supplemental oxygen. Some do not have. Majority of them do have respiratory symptoms. Some of them have already pretty much broken their temperature. They're afebrile. Some are still, running fever every now and then. So we started, Dr. Agun and the physician team, they started these individuals, majority of them on the remdesivir. So, we're using the remdesivir medication on these individuals.
What is other supplemental oxygen?
Meaning nasal cannula, they get oxygen through the nasal cannula.
Okay.
Right, and they're depending on, their oxygen saturation. Most commonly 2 liters. Sometimes they go up as high as 5 or even higher, just depending on their oxygen saturation within their system and how, they're struggling with breathing. And so because of their oxygen saturation level dropping down in the low 90s and 80s, they need supplemental oxygen.
And so when you say hospitalization, are they in ICU or which COVID care unit are they in?
Okay. We have in the COVID care too, that's basically ramped up for ICU level of care. So the male individual who needs the ICU level of care, he's in care two. And then I think there are three other individuals who need telemetry monitoring in that same unit. So, we're closely watching those three individuals who need to be on a continuous cardiac monitoring, meaning their heart rate, their heart rhythm is constantly being monitored and watched to see if there's any aberrancies, any abnormalities, or any changes, sudden changes in the rate and the rhythm. So those are the four who are in care two, and that's in the second floor between ER and ICU. So that's our care two. In care three, which is our fourth floor, the former pediatrics unit, we converted that to a COVID care three unit. In there, we have three individuals who are medical individuals. They don't need cardiac monitoring, telemetry capability. They're up and about, but they're isolated in their rooms.
So, all right, so that's a total of 7. And you said, I think when we interviewed you last time, you said in the COVID care unit 2, there are only 5 beds, right?
Correct.
Okay.
5 beds.
Okay. So how concerning is that? I mean, what if we have more people coming in? Because we had 16 last night or yesterday that might need this ICU level of care.
Okay. Then we're going to need to be switching people around, like those 4 individuals who are there. 3 individuals who are there in the care 2, occupying those ICU level of beds. We're going to need to move them out to the care 3 unit and bring those individuals who need ICU level of care. So we do a lot of juggling around, moving around with these individuals. And that's the reason why we really limit and restrict visitors coming in, because we're moving patients around who are COVID positive.
Right.
Lillian, Guam is small, and you hear things. And going back to this gentleman on the ventilator, we just hear from the family that it's not. I just as a former ICU nurse, and you said this guy's younger, in the 30s. What's it like to see this, and what's different about his case? And of course, not getting into too many specifics, right? But when you see somebody who's young on a ventilator struggling with this thing, what's that like for nurses?
Again, very concerning, and a young individual, with potential in life, but here he is struggling because of the infection that has really severely taken a toll on particularly his respiratory, his lung system. And so I think he has a history of smoking cigarettes. And so that, again, compromised his function of his respiratory, his lungs, because of that history of smoking. And so he's got that factor that definitely did not help or does not help. But, he is on the ventilator. And so we continue to monitor him and hope that, time will heal him, with his lung capacity. But it's sad to see a young individual critically ill like this. And so we're all hoping, and the nurses are doing their best to, hopefully get him through this really battle.
And it looks like that's what we're seeing, is we're seeing a lot of younger people getting COVID. I mean, I'm looking at the breakdown demographics in the SID report, and you have like from 0 to 9 years old, 14, 10 to 19, 30 people with COVID-19, 20, to 29-year-old, 91 people with a COVID-19, 30 to 39, 78 people. That is a lot.
What do you make of these numbers, Lillian? Why are we seeing these numbers with the younger demographic?
Well, as it was mentioned, they're out there. They're young. They think they're not taking it very seriously. They don't think they're vulnerable, but as the governor has pointed out, this virus does not discriminate age or anything. It jumps to a human host. If you're a human being, it jumps to you regardless of your age, your color, your, status. You're a human host for this virus. And so with the young people, remember when the bars open, young people like to enjoy life. And, of course, rightfully so. When we were young, we like to enjoy life, right? And we think we're not vulnerable to anything. But, this virus just does not discriminate anybody. And so the young people really we need to just keep reminding them, take heed of this warning, because it can hit you. This virus can just, invade your body
Mm-hmm.
at any given moment that you're not wearing your mask, you're not protecting yourself, and you're not protecting others. So wear your mask.
You know, I'm also looking at the SIT report, and it said there were 35 individuals in the government isolation facility. I'm not sure what the capacity is over at, I'm not sure, is it Wyndham Garden or Days Inn? I'm not sure which one is the government isolation facility these days. But are you guys prepping the SNU or the SNF?
We are. We're
Mhm.
covering the SNU, and one of the biggest hurdles is still the chiller, the air condition. The 25-year-old chiller system that we have up at SNU, it got repaired. It's still not 100% functional and operational, so it's not keeping the facility cool enough. And so we are bringing in, working with an institution in the community, donating chillers in the interim, while we are in the process of working with a contractor to bring in a brand new chiller and get it installed and get it commissioned. So, in the long run, we're going to get that brand new permanent chiller. In the interim, we are going to be installing and commissioning a temporary use chiller that we hope will keep the facility cool.
Right.
Once we get in place, and we can then, because we're also working to ramp it up, specifically just for the isolation and for overflow from our acute care facility. And we're ramping it up to have the capacity that if the individuals there at the SIF, their condition deteriorates, that they need critical ICU care, we can keep them there. We don't have to transport them back to this acute care facility here in Tamuning. So that's in the works right now.
Lillian, I remember a few months ago, and I believe this is when we were still in the lockdown, there were a lot of things going on at GMH in terms of trying to increase the morgue capacity and also to do other things in anticipation of this big surge. And then I feel like there was a kind of a dialing back, or if there was, maybe you could just tell us what's the status on these kind of preparations that were being made back when we thought we were going to get the 5,000, the 6,000 deaths.
Right. We do have a, I guess it's a container, a refrigerated container that's donated again to give us that capacity, more capacity. It's one container. I think it's a 40-foot, but it can only hold 14 bodies, 14 remains. Fortunately, we are able to maintain or adequately accommodate those individuals who pass on between our morgue, which we have a 12 cubicle capacity, and then the CME morgue, they have a 9 cubicle capacity. And so there's, there are times when it's full, but then the funeral homes work with us to then pick up those human remains and get them processed for funerals. So, whenever they do, then it opens up the space. And so we haven't had to use that container as a backup for morgue capacity. So knock on wood, we won't need it, but, it's always best to have something in place.
Right,
if you do
right.
need it.
I wanted to go back to the SNF, SNU. You were mentioning that you guys were ramping it up and trying to get a donation for the chiller until you were able to purchase a brand new chiller for the Barragata Heights facility. What's the target date to try and get that up and running? And do you know what the capacity is for the government isolation facility?
Okay. In terms of the government isolation facility, I think it has a capacity of either 40 plus or even up to 50, because right now, as of yesterday, there were 42 individuals at that isolation facility. And so hopefully that some of those people have been already in isolation for so many days that they've met that criteria, that they can then be released home and that they are no longer contagious or communicable.
Right.
So, it's an ongoing process. With regards to the chiller at the SIF, the COVID isolation facility / skilled nursing facility in Barragata Heights, the target date was yesterday. or even last year for that chiller to get replaced. But, unfortunately, the process takes time.
Yeah.
Mhm.
So we're shooting, we did the RFQ. We're shooting that we can get that finalized to award the bidder that proposed, the most qualified and, the least expensive for them to then get that chiller where it's at right now, get it transported and installed and commissioned to operate, to run. We're hoping that maybe before the end of August, we can get that in place.
Okay. And so, because there's no chiller there, is there anyone actually at the SNF facility? Because I was reading, I want to say in the board minutes for one of the last GMH meetings, that there were patients that were over at Catholic Social Services.
Correct. We moved the long-term care residents or patients out of the SIF SNF back in, March.
Mm-hmm.
He prepared that facility for it to be a COVID isolation facility. We moved them here to our third floor medical surgical annex. And then when we realized that, the numbers are increasing, we want to make sure we protect those residents because of their age and their, condition makes them very vulnerable to then get infected. We moved them out of here in April to the Catholic Social Services facility. They allowed us to occupy that facility, just to protect them. But so they're there right now. There are no patients or residents at the SNF facility in Barragata Heights, Sabana Drive. No patients are there at all. We do have staff, security guard, and FM to make sure, that the facility is not invaded or
Right.
tampered
Yeah.
with, and they're guarding it and making sure that things are are in place and not tampered with or damaged.
Lillian, so
we
there's just
have
no
staff
there's no aircon up at that facility. Is that what you're saying?
There is, like I said
Oh,
earlier,
okay.
it got what we have there as a 25-year-old chiller.
I
It
got
got
you. Okay.
repaired,
Right
but
on.
not 100% operational. So it's not keeping the facility as cool
So
as
is
we
there
want it to
mold
be
or any kind of
for occupancy.
mold, or is that an
No,
issue?
that's why we have housekeeping staff there too, to keep it clean on a daily basis.
And how long have the patients been over at Catholic Social Services, and are there GMH staff staffing Catholic Social
Absolutely.
Services?
Yeah, they are still our responsibility. And so, yes, all those skilled nursing unit staff that manage or, take care of those patients from the Barragata Heights facility to even here at third floor, we move them up there. And they are the ones taking care of those patients at the Catholic Social Services. And they are still our patients, our hospital patients. They're in our system. They're registered in our system so that we can make sure their medications are transported over from here to that facility. The food, the meals that they need to have, basically everything in terms of like linens, we provide, for them there. So they are still our patients.
Right. How long have they been there? I'm sorry.
Sorry, I think I forgot to answer that question. Since April 14, we moved them there.
Okay. And I think I was reading in the minutes that is there a contract still pending for this arrangement?
Yes, ma'am. The contract, the agreement, the memorandum of agreement is still pending. And we're lucky that, Catholic Social Services have been very gracious to, not kick us out, not evict us. And so, yes, that is still pending.
And so how much would we have to pay? What's the payment arrangement, or just, I guess?
What we had in the MOA was that, we will pay them $10,000 a month. That's the agreement.
Okay.
All right. Oh, Lillian, I just wanted to ask, so we had public health on in the last week, and they said that because the GDOE nurses who had been detailed to assist public health in things like the community testing, they've all gone back to the schools to prepare for the reopening. And
Correct.
What public health had said was they don't have enough nurses to conduct the community testing. And I know we're moving to the targeted testing, but is the GMH nurses being asked to provide any type of assistance to public health, or?
No, we haven't been asked, and even if they do ask, we really can't support that because we're taking care of the COVID patients,
Right.
and we're still struggling with our shortage of nurses, particularly in the ICU. But the one good thing is, in our recruitment and retention efforts, we are able now to increase our capacity in the ICU from 6 to 8. We can sustain accommodating 8 patients. Our actual physical bed capacity in ICU is 14, but we just don't have the experienced
Right.
critical care nurses to take care of those patients. But and it's unfortunate that we really continue to struggle with nursing shortage throughout the island. And we like, as much as we like for the DOE nurses to continue helping public health, they also have their responsibility in the school
Right.
setting.
Right.
But the concern I had with opening up the school again, these kids, they see each other's masks and they say, "Hey, I like your mask. Let's trade." So things like that, and it just makes it a venue for transmission. And I've said this before: health and life trumps education. We need to protect the health and the life of these children who are also vulnerable. And so, education can wait. I mean, what's another 4 months, right? Hopefully that we have a vaccine by January. And so, I mean, there are other ways to continue the teaching, the education, and the academic needs of these children. But to put them back into the school, we need to really, really look at that and make sure that we protect those children and those students.
Um, wow. I'm
Sorry,
just like, wow. You just,
sorry, I went off
yeah.
the.
No, that's, I mean, again, Lillian, you always, you always kind of go off, but I feel like it's in a good way. You know what I mean? So that was very interesting to hear. Going back to the nurses, right? As we struggle with these shortages, and I know you said you have an amazing staff, and we agree. What about the burnout, Lillian? How do you is there a way to address the burnout without jeopardizing patient care?
Well, we make sure, I know that we haven't had people go on vacation, but we make sure they have their days off, and we make sure that we don't, stress them out with continuous 7, 8 days of working. We want to make sure that they get their time off and they spend it with their family. And if, somebody calls in sick, we say, okay, you take care of yourself. We don't, not like before when we're so short of nurses. Oh man, can you just take Tylenol and come into work?
Wow.
But no, we let them take their days off, and we let them, have time off.
What about the hospital's budget? Are you guys, because I know we spoke with Steve Guerrero from the legislature, and he was mentioning that practically every single agency is going to take a cut.
You-
Go ahead.
Go ahead.
Yeah, I was going to say.
No, what Senator Terlahi sent us over the weekend in terms of the substituted bill, looking at what they had allocated for GMH, it's basically the same amount, if not a little bit more. I think it was 29 million, but where they cut back was the pharmaceutical allocation. The governor and we requested 20 million, but the legislature allocated 18 million. But from the general fund, we requested 4 million, what they gave us was 8 million. So in some ways, they cut back a little bit, but then in another funding source, they bumped it up a little more. So I think, I don't know, I haven't been paying attention. I haven't had time to listen to the legislative session, so
Right.
I don't know if they've already addressed GMH budget and if there were any cuts. I haven't had that information yet. But as of the Sunday substituted bill that Senator Teresa Lahi sent to me, I looked at it, and it was pretty good.
Right.
And just real quickly before we let you go, I'm sorry, but I wanted to follow up on the Catholic Social Services. You said that they've been handling patients over at Catholic Social Services, moved from the SNF. How many patients are over at Catholic Social Services, and have they been paid anything?
We haven't had a chance to pay because we don't have the agreement, the MOA, official agreement. But we are in communication with Diana Calvo, and so that we want to make sure we make the payment. In terms of the number of patients there, because of the limited space, the maximum that they can accommodate is 11, and so we have 11 right now, residents there.
And these are all Manumco?
They're not all Manamco. These are some individuals who are young but are bedridden and need long-term care. So most of them are, but there are a few who've had early age, a young age of stroke, and so they're kind of like bedridden, and so they need that long-term care management.
Okay.
Lillian, I want to go back to what you said about the reopening of schools before we let you go, but I think it's almost a mic drop. What you said, your concerns about reopening of public schools in 5 days. Are these opinions that you shared with us, are they opinions that a lot of other medical professionals that share with you?
You know what, I haven't really had a chance to discuss it with other professionals, but I have discussed it with our executive team, and they kind of feel the same. But, we also want to respect the school in their mission that, they want to provide the education for the students. And so, okay, let's give it a try, but let's make sure we put in the measures to ensure as much as possible that they can to protect those students and, and prevent the transmission. But, and we'll see how it goes.
Yeah.
And I know that they are, they're exhausting all efforts. They're looking at everything to make sure that they have their PPEs and, preparing, and they are having also the option of online. So,
Well, we have John Fernandez coming up in a little bit, so we'll go ahead and ask him to respond to those concerns. Lillian, thank you so much for your
Thanks,
time.
Lillian.
A lot of great info in there. Appreciate it.
take care and keep your mask on.
Right on.
Stay
And
safe.
we have a comment here from Mike. Thank a nurse today.
There
So
you go.
thank you
All right.
guys. Say thank you to your nurses
Yes.
for us.
Thank everybody.
Okay, Esta.
Bye.
Joss, wash your hands on your thumbs. 7:57. We got to take a short break, guys. We're coming back with more of The Link on the Breeze.
Thanks.
93.9.
I was going to say thanks for watching us on TV 11.
Right, and
8 o'clock.
yes, thank you, KUAM TV 11. Remember, Tuesday, Wednesday, Thursday, Friday, KUAM TV 11. We do it KUAM TV 8 on Monday. All right, so our viewers on TV 11, let's go log on to your grandkids' Facebook and check out our KUAM News Facebook live stream. Okay, because it's Edward R. Murrow awarding. Tu nga si Edward Murrow? Yeah, Familia Murrow. We got an award for it. Check it out. It's our social media at 7:57. Back with more of The Link on the Breeze. Good morning.